Okay, welcome everybody to our seminar on data ethics and the COVID-19 crisis. I'm Daniel Carey, Director of the Moore Institute at NUI Galway. This is part of a series that we've developed in conjunction with the Moore Institute COVID-19 Response Group. This is part of a wider initiative in the university with the research institutes. We have a session coming up next week at the same time on education during COVID-19, precarity, privilege, and purpose. So just to let you know about that. Today, we are discussing the whole question of data gathering during the crisis, the use of contact tracing apps and IT solutions generally, the balance between social benefit and surveillance, and how we might think about those questions. We have a great lineup of speakers, and I'll introduce them in a moment. Our format is a panel discussion. The speakers will talk for about 5 minutes each, and we'll have plenty of time for questions afterwards. To ask a question, you'll notice on Zoom that there's a Q&A button, so you can use that. You can also hold up your hand. There's a button for that as well, if you want to be recognized. But the Q&A function is quite straightforward. I want to thank David Kelly. He's Digital Humanities Manager in the Moore Institute, for being our host behind the scenes. Our speakers, in order of appearance, are Mathieu, Rob Kitchin, Heike Felzmann, Karlin, Lillington, and Linnet Taylor. So I'll introduce them now. Mathieu is Established Professor of Data Analytics. He's Director of the Data Science Institute, and he is the Site Director of the Insight SFI Research Center for Data Analytics at NUI Galway. His research relates to knowledge and data engineering. He's interested in aspects related to ethics and their implications for technology developments, and how ethics by design methodologies can help support creating more valuable technological processes. Rob Kitchin is a professor in the Maynooth University Social Science Institute. He has conducted extensive research on digital technologies and their impact on society. And he was the principal investigator of the Programmable City project funded by the ERC. He's currently a co-PI on the Building City Dashboards project, which is funded by SFI here in Ireland. He's co-author of 30 academic books, including Slow Computing, Why We Need Balanced Digital Lives, which will appear in September. Heike Felzmann is lecturer in philosophy and ethics at NUI Galway. She's affiliated to the Center for Bioethical Research and Analysis, COBRA, at NUI Galway. She specializes in bioethics, healthcare, and information ethics, especially robot ethics. And she's been involved in a range of European-funded projects on ethics of healthcare, robotics, and technology. Karlin Lillington is a technology columnist for the Irish Times. She's written widely on questions of data security in Ireland, Europe, and the US, on big tech companies and their responsibilities, and has been instrumental in creating public awareness and discussion. Linnet Taylor is Associate Professor at the Tilburg Institute for Law, Technology, and Society. She is a social scientist and geographer. Her research focuses on digital data, representation, and democracy, with particular attention to transnational governance issues. She leads the ERC Global Data Justice Project, which is developing a conceptual framework for the ethical and beneficial governance of data technologies on the global level. So thank you again to all of you for participating. Very much looking forward to the discussion today. At this point, I'll turn over to Mathieu, who is our first speaker. So Mathieu.
Thank you very much, Dan. I hope you can hear me all right. And thank you for the invitation and for the introduction. Hi, everybody. I'm always embarrassed with the unreasonable long list of titles that are attached to my name, especially because it must make it completely evident that I'm probably the least qualified person here to talk about ethics. By training, I'm a developer, I'm a coder. I create algorithms and apply algorithms to create applications. And I very much hope that that doesn't mean that your questions are going to be what are you doing here then? And rather, why are there so few people like you usually in this kind of conversations? That's a question I've been asking myself for quite a long time. People like me are driven by things that don't necessarily relate a lot with ethics and with a lot of different aspects of ethics. We tend to be driven by trying to solve problems, and most of the problems in data science are, broadly speaking, problems of prediction. You know, what we do on a daily basis is being given some data, trying to figure out, you know, something that the data doesn't say explicitly, but somehow we can try to guess out of it, whether it's what movie you would like to see next, whether we can trust you with a loan, or whether you are going to catch COVID-19 based on your behavior. And we try to do that as efficiently and accurately as possible. That's our main way of thinking is, how can we make this thing best reflect the data we have? How can we make this algorithm give us a result as fast as possible, which is as robust as possible with respect to the data set we currently have? And what's completely obvious in that description is that in doing this, we do not think about ethical implications. There is very little consideration for it. There is very little consideration on whether this is the right data set to do it, on whether how the people who are going to give the result to will be able to interpret and understand them in a way that makes sense. This is not in that part of the process that we are looking at this, and that, I believe, is an issue. Is an issue that the connection between what is a practice of building data-intensive applications and building data sciences process and what is their potential implication is not there. There is a gap. And so why I'm talking about that in the context of COVID-19 is because I believe this is now becoming even a bigger challenge. The reason for that, well, the two reasons I can see are both related to time. One is the approach we tend to advocate to try to solve this is to integrate within the methodologies for designing data science processes times and places for reflection, for conversation with social scientists and with ethicists about potential implications, about anticipating on what might be done in the future with what we are building, or what kind of assumption people might make with it, what would happen if it was used and applied on or by millions of people, or by a select few, or by in a way that is what is planned, or in a way that is abused. And the problem we have right now is that there is a lot of expectation on technologies to help solve the crisis. And the crisis, by definition, has a certain level of urgency to it. And therefore, suggesting that we need to solve this urgent crisis by pausing and reflecting is a bit of an issue. And that's the practical aspect. The less practical, in a sense, but I think just as challenging is on one of the reasons why it's very hard to do that is because, as I said before, a lot of it is about anticipating issues, understanding what will be in the implication in the future. A lot of this reflection and this conversation between the technical and the ethics aspects is a bit of an exercise in science fiction, frankly. Mm-hmm. Is understanding how things we are building now might affect society later. And you can see the problem here, which is this is about making assumptions and imagining futures. And right now, imagining what the future is going to be even in a month is extremely tricky. Mm. So I'm very interested in being here and talking to a wide range of people, because what I believe we as a community, and when I say we, I include all different kinds of skills and capabilities and all different kinds of reflection, is to develop an ability to respond to crisis where technology is required in a way to support this response, but be done in an ethical way. So in computer science and engineering, there is a notion that exists, which is called rapid prototype development, which is this idea of having sufficiently advanced technologies that we can very quickly transform an abstract concept into a testable prototype. And my hope is that maybe not for this crisis, but being prepared for the next one, we can start focusing on building methods for rapid ethical development, the ability to quickly respond to the need for new technological solutions that are also ethical.
Thank you. Wow, that's extremely helpful. Yeah, I'm very interested in your emphasis on time pressures and how they come to bear. This is to a certain extent a unique situation in that respect. And that's why partly why people are worried about the long-term implications, because we may be making decisions without realizing that we're making decisions. But I like the idea that there's also an element of science fiction in this. Maybe that's because I'm in the English department. But right, so now we'll move to Rob Kitchin. Rob, if you would take over from here and give us your thoughts.
Okay, thanks. So if I'm looking over the top of you, it's because my notes are on a screen above my on my laptop. So there's lots of tech being looked at and rolled out across different countries in relation to the crisis. So 4 ones that are really looking at the spread of the virus as opposed to tackling it medically or in another way are contact tracing. So being able to trace people who might have been in contact with people who are infected. There's quarantine enforcement and movement position. So quarantine enforcement is making sure people stay in their home and they don't leave their home. A movement permission is being given permission to move and then maybe using an app with a QR code to get access into buildings and so on. There's pattern and flow modeling, and there's symptom tracking. And what I want to do is just briefly talk about 3 aspects related to kind of ethics in relation to these. Across the 3 frameworks of kind of technical, practical, kind of civil liberties and citizenship, and then surveillance capitalism. And on the technical, practical, we can kind of look at this as like an ethics of a weak technical spec or false positives and so on. So we're going to give people advice about whether they should self-isolate or whether they need to go and get a test, or so there's going to be some form of decision making based on these technologies, or these technologies are going to be used to enforce that. Now, there's clear implications to this because you might be keeping frontline staff off of work unnecessarily. You might be denying other people making a living or being able to socialize or do whatever, right? So if you start to think about contact tracing, there's about 28 countries have already rolled out a contact tracing app. There's about 11 more, which we know are in progress. And they're particularly, usually we're using Bluetooth. Now, the problem with Bluetooth is there's a question as to whether it has sufficient resolution, the 2-meter thing. So if I'm going to start getting positive contacts on people that are actually 10 meters away from me or 5 meters away from me, and also there's going to be an issue around time frame. So in the British app, it's people have been within 2 meters for 15 minutes or more. But of course, I could have been passing somebody in a supermarket aisle who sneezed, right? And that's a significant contact, which I'm not. Also, doesn't pick up, I might get it off of a surface. So I could pick up the thing off a surface, not off of actually meeting people. Now, there's issues around the tech, right? So there's issues of representativeness. So for example, there's only 28% of people in Ireland have a smartphone. There's issues around data quality, reliability, issues around being able to dupe and spoof the data, issues around rule sets and parameters, about deciding what decision is given to what people. And basically, so there's issues around the technical limitations that's going to lead to sizable gaps and also a very large number of false positives. That's just going to give quite a high signal-to-noise ratio. But we're going to make decisions based on that data. So there's an ethics around basing decisions around these kind of technologies and these kinds of systems. Then there's the issue around kind of civil liberties and citizenship, which seems to be getting a lot of commentary at the minute, particularly around privacy issues. This is kind of an ethics of what does the tech do and what are its implications. I'm not going to talk about the privacy things because I think the privacy issue is a little bit of a red herring. There are issues there around privacy and about data security. I think they can be managed. I think the bigger issue is around governmentality and around things like control creep and so on. So these are technologies designed to control our behavior and control our movement. They're about social and spatial sourcing. They're about redlining in the sense of quarantining and so on. They're about mass population profiling. They obviously work to normalize mass surveillance at scale. And they have a control, there's a worry around notions of control creep. So we put this technology in place and it starts to become normalized technology that becomes part of our everyday governmentality going forward. So we know this from 9/11, technologies and surveillance systems rolled out in 9/11 are still with us. They were not rolled back. So anything we implement now could become long-term infrastructure, and there's clearly issues around that. And there's a lot of questions around due process, around oversight, around redress, around rollback and so on. And then the last kind of issue, I guess, is around surveillance capitalism. It's around an ethics of what does the tech enable. So effectively what we've got here is state-sanctioned surveillance capitalism. We're leveraging off of this large private infrastructure, mobile phone apps, app development, and so on. And all of the kind of civil liberties kind of issues that we've been trying to push back on, we're now normalizing and embracing because it serves our purpose. So we're basically embedding corporations into the process of governance, and we're sanctioning this type of surveillance capitalism. And we're also obviously creating new market opportunities for these companies and potentially creating gateways into public health data and other kinds of state data. And there's an element to which the way in which these companies are engaging and are offering their services is kind of a COVID washing, if you like, a kind of washing of surveillance capitalism, kind of real questions, the real questions there. And I think I'll leave it there. The only other thing I would say about the technical thing at the beginning on the contact tracing is there are some critical conditions that make it quite difficult to implement in practice, which is you have to have extensive testing. You're going to trace people, you can only trace them if you know they've been tested positive. So if you're going to create a massive system of contact tracing, then you have to have a massive system of testing. And you also need probably about 60% of your population to participate, which is about 80% of smartphone users. So if those two conditions are not met, then we're actually rolling out a whole series of infrastructure that won't work. And obviously there's issues there as well. And whether that will happen is a mute question. Public trust in government around data and their ability to deliver these kinds of projects is not great. And if it's implemented poorly, it could have a chilling effect on public trust and on the delivery of public health. So there are those kinds of questions as well. That we don't want to do this poorly, basically, because it potentially has a negative effect.
Thanks, Rob. That's very interesting. One of the issues that I think strikes me is whether, again, if this is done badly, what are the implications of it? But it's also, if the technical solution isn't there, will that actually influence anything in the process? Like, in other words, you might come up with a very cogent argument for why this won't work. I'm not sure that that in itself will have enough impact to dissuade governments from adopting it. Slightly different question, but we may get a chance to come back to that. So you might, Rob, by the way, send us a link to your blog, maybe in the chat function, because I know you published a piece yesterday that I think people will find very interesting. Right, so let's move on to Heike Felzmann. Heike, if you could.
Okay, I guess I'll just take up where Rob ended with the issue of trust and the risks around trust. Yeah, I mean, I'd also think is really important the last few bits that Rob was highlighting around the risks of badly rolled out technologies which have been hyped, but the actual limitations haven't quite been taken into account. So that's really important in communicating about the technologies. And I guess that's where people like Mathieu are really important to identify and clarify what a technology can do and cannot do, and what the constraints are there. Yeah, so I think I'll just have a few comments around the question of trust, because it kind of organically moves on from what we already talked about. Because one of the major challenges around the implementation of technologies and the attitudes in society towards technology has been an increasing level of distrust. And yeah, in recent times, this the notion of trustworthy AI and trustworthy users of technology in the wider context of society in light of all the impacts that they have and the potential negative as well as the positive ones. Yeah, and I mean, many people here, or some of you at least, may be aware of that document that the higher level expert group and the European Commission published last year around trustworthy AI. And so maybe just thinking a little bit more about trust and trustworthiness is important in this context, because as you were saying, if a technology is rolled out and people don't trust it at the moment that it is rolled out, that's one challenge. If it is rolled out and people have high hopes for it, but then it turns out because only 30% of the people download it, or because actually Bluetooth doesn't work in the way of the specificity that it needs to have, you end up with something that people had trusted that doesn't turn out to do the job, and you may have a backlash in terms of loss of trust. And so, yeah, so maybe what might make sense is to look at some of the aspects that have been proposed now. Trust and trustworthiness as well has been researched in a number of areas. There's a big literature in philosophy around understanding trust and trustworthiness. There's a lot of research on the psychological side around what it is that that makes people trust, what components of trust actually are. We can't go into that in 5 minutes, so I'll just go through some of the aspects that that are highlighted in the higher level expert group documentation around what aspects of technology we may need to pay attention to if we want a trustworthy technology. And so one of them is focusing on the role of human and human oversight in the context of technologies. So yes, we can create algorithms and then the algorithms do things, but at the same time, in the GDPR and more generally, there is the sense, well, technology shouldn't just be doing things by itself. Once it has been developed, there has to be some way in which it is embedded in human context and in human oversight. And that human oversight should be driven by ideas of human rights, by ensuring that there's autonomy for persons, etc. The second aspect around trustworthiness is the technical side. So what we talked about before, that what the technology promises to do is actually happening, so that that is accurate, that is reliable, that is sufficiently resilient, so that it can actually do what it promises to do. Another aspect is the question of privacy and data governance more generally. So how can we make sure, and that's one of the big themes at the moment that a lot of people talk about when they talk about data and COVID, the question of the privacy, the question of surveillance, and how technology development can take that into account through ideas such as privacy and data protection by design, for example. Transparency has been brought up as a quite significant aspect as well, in the sense of making code available so that people can actually see what is happening in relation to what does this app, if it is a contact tracing app, for example, what does it actually do, and is it open for society, for competent people in the public to actually have a look at, and is there anything that's hidden that is going on? And so there has been, as far as I understand, a good bit of back and forth around whether it's appropriate to have an app that is not open for public scrutiny, for example. There's always in the technology domain the question of discrimination and fairness, so the issues of different ways of encoding biases, questions of accessibility. So who will have access to this app and who isn't? So what about those who are not smartphone owners? What about those who may have older versions that may not be supported by whatever is being brought on stream? So those accessibility types of issues also need to be taken into account as part of something that is societally trustworthy. Yeah, the general issue of societal well-being, so sustainability, the social impact, what does it do to democracy? So all those issues that Rob already pointed at in relation to the control creep, the infrastructures that are being designed that then just stay on because it's easier to keep them going than to come up with something new. And yeah, so to think about it in the sense of the science fiction that Mathieu mentioned, we need to envisage what might happen to democracy in society if these things are being implemented in a particular way. What kinds of mitigating measures might there be? And then question of accountability. So who actually is accountable? How can we access accountability? Are things auditable? Is there actually going to be sufficient reporting? Is there any way of addressing of investigating the impact and of addressing any challenges arising from that? So I guess I'll leave it at that.
Thank you, Heike. Yeah, that final point you raise, I think, is obviously an extremely significant one about accountability. And that's something that also gets lost in that shuffle of very rapid response, responding to a crisis, trying to make decisions and take appropriate courses of action in the midst of a very pressurized situation. We turn now to Karlin, Lillington. So thanks, Karlin.
There we go.
Great.
Thank you. Some people, as I knew would happen, have touched on some of what I would have touched on. So I'll make a couple of points along the way, which also will connect in with some of what others have said. I think every time we have this kind of a major crisis, and of course this is not a crisis that we have had for most of us in our own lifetime, but these major crises that involve serious societal concern and a need to, in some way, perform some sort of useful surveillance, I would say, tend to encourage very poorly thought through responses, which then appeal to the majority of people who have a little bit of knowledge, but not a lot of knowledge, and even to a lot of us who have a lot of knowledge, but maybe not across enough areas to really understand the implications of what's being done. And I think what happened after 9/11 and the bringing in of the Patriot Act in the US is a good example of this, because it's continued to be utilized a decade on nearly now. It keeps getting renewed in various formats. So a lot of the most egregious elements continue to be there or are pushed for by surveillance agencies. So I think the point that we need to think carefully about what we introduce in the name of one specific need, there's many considerations to balance off each other as we go about deciding what we do. Now, just some points of what some of the problems tend to be is that often the things that are proposed sound okay, and they can also sound very logical. For example, the extra powers need to be granted because we need extra security. In the case of 9/11 and the Patriot Act, right now it's extra powers and a backtracking on some privacy protections, for example, should be done because we need some way out of the situation that we're in without being stuck waiting for a vaccine or new therapies. And I think I would note that one of the frustrations for many of us who consider ourselves privacy advocates is that sometimes the concern about privacy in recent weeks has been trotted out as we're all against anything being done and therefore we're responsible for the coffins stacking up, this sort of thing, which I've actually seen come out in a tweet. Actually, most people that I know actually are very supportive of the idea of moving forward in a well-framed way to bring in a response that is actually effective as well as responsible and protective of basic rights. So I think it's worth making that statement at the start. I think another problem is there's different assumptions and capabilities for each stakeholder. Each tends to think the other party can do more than they actually can. And I think everybody is eager to make something work well, and therefore they don't reveal perhaps their own the weaknesses they're aware of, or they are willingly move into an area of magical thinking. And I think this is, here I would think we have three parties: the government, the medical specialists, and technologists. And the problem right now is they all have different expectations. They don't necessarily mesh. Some of the proposed solutions simply can't be done in technical terms, but the medical and government people assume that they can. Some of the government people think the medical and the technical solutions will solve societal issues that they probably can't easily solve on their own. And the technologists, the medical people think the technologists can do things that they can't actually do, as does the government. And the technologists often think that they or misinterpret what the medical specialists want or are able to do if they're given certain types of data. And I think on the technology side, there tends to be this attitude of, we'll just collect everything and throw it at the people and see what they can make of these things. Some of the basics that I think we need to keep in mind, some basics aren't in place either. For example, there's no industry standard right now for aggregating data in the EU. Like this is something that really needs to be there. Again, I think of Mathieu's point about the time element. Unfortunately, this isn't the time, we don't really have the luxury of time to consider some of these issues right now, but we need to consider them. We need to find that luxury somewhere. Also, there's this problem of course, once the technologists, the government, and medical people talk a lot about that these are anonymous data sets, but of course they can be very revealing in their own right. And once you start to combine data sets, they can be quite revealing as well. A little side note too that I think is important with the proposed Irish app, which has a major problem with what Heike just pointed out, transparency. We don't know the company involved, although it seems to be one that was Enterprise Ireland sent out a press release about an Irish company that seems to be the one that's working on it, but it's not clear if they are. We don't know the code, we don't know the security, we don't really know what they're trying to gather. And they say that they're working in cooperation with the DPC or in consultation with the Data Protection Commissioner, but what does that actually mean? And should a Data Protection Commission at any time be doing consultancy work? Because then who do we complain to if we have issues about the app? There isn't anybody that you don't feel like you have a neutral party. I think there should be third-party data consultants working there. I also think there should be some of our civil society groups like Digital Rights Ireland should, for example, be directly, some of our ethicists here on this panel could be usefully discussing things with the government. There is that issue then of rolling out something which doesn't have the actual capabilities that you believed it would have, and you lose trust. You probably aren't going to get a second chance on that. You won't get the take up. I think we have, you overpromise on what an app can do, and people then get lax on other areas that are important, like social distancing and hand washing. The mission creep point has been made, but I would also point to the fact that the public services card we already have an example here of the government introducing a project that was supposed to be used in one narrow way and keeps expanding outwards. And once you have a government app that's on everybody's phone, like, you really want to be able to trust the government and what this app is being used for, because I do feel we need some sort of app. And then finally, I'd like to keep in mind, it's not just out. And really need watching other proposals for managing this crisis, for example, on DNA gathering and genomic research. We don't really know whether there have been proposals to start to sequence some of the versions of the virus that have been collected in Ireland. We don't really know whether there's any attempt to sort of track people to gather data for public or private research. In this case, it's probably private research. And so you don't really, it's very easy for commercial research to slip in under the guise of data gathering for public benefit, but it's actually really going to go to saleable database creation. And I'll leave it there. Thanks.
Thank you very much, Karlin. Yeah, there's obviously that element of mission creep, as it's sometimes referred to, and I think anybody paying attention to the U.S. will be struck by analogies with the Patriot Act, which proved to be very convenient. And of course, there are moments in time politically when it becomes very difficult there's no leverage, no position to stand on in resisting a certain kind of trend. So I think it's going to be important to see how that develops. So I'll turn now to Linnet Taylor, our last speaker in the series. Linnet?
Hi, thanks very much. So I'm trying to think what I can say that adds to these very good perspectives. I guess my work focuses on the dialogue between national and global perspectives around data and around technology. So from that perspective, which we're researching actively at the moment, I think one thing that's important to say is that there's a real tension between the two levels, and that our economies are all tied together now, and we need to consider the global while we consider the national. So it matters what Ireland does, it matters what Europe does, but as long as people in Africa or Asia or Latin America still have the pandemic going, even if we're totally successful in containing it here, we all still have the pandemic going, right? So there's a very important question about how we encounter other approaches, how our approach meshes with those other approaches or doesn't, and how norms elsewhere affect the norms that we have here. And I think we're going to see some interesting things emerging over the next couple of years around shared norms around these things. So first of all the measures that we are following here in high-income countries are only possible for the richest people in the world. So hand washing, lockdown, testing, treatment, masks, social distancing, all of these are luxuries. Most people in the world don't get to do them. So that, for one thing, sort of refocuses the perspective a bit on how we might succeed in combating this pandemic. So sort of the we of coronavirus is currently not the global we, but the tech is being referenced as if it were actually universal. The we is really about people who are relatively well off and relatively able to combat the disease, and the tech is being developed for them. But as I said, as long as this disease is still going in less resourced places, we all have the disease on our doorsteps. So that's one thing to consider. Another is different normative viewpoints on what's going on. There's a huge difference in the assumptions and perceptions of this disease across different regions. So in a lot of Asia, this is seen as a continuum from SARS and MERS, which happened in this generation, right? People already understand the precautions, they whip out their face masks, they start socially distancing. And we see very, very different understandings of solidarity, of what you need to do and how long you need to do it as well, importantly. So the nature of acceptance of the tech that's being used is very different. We're actually seeing more pushback on function creep, I think, oddly in China, Singapore, other authoritarian nations right now in Asia, than we are in Europe. People in Europe are totally shocked that this has come to our doorstep and that we're actually vulnerable, because we've seen SARS and MERS and Ebola go by and we've pretty much been untouched. So now we actually have to take the precautions we've seen Asians taking for a long time. People are very surprised and we're doubting whether this is a good idea. And so we're sort of looking to tech to solve that problem. And it's not going to do that for us. Equally, in lower income African countries, this is going to be seen as one threat among many, and where people have limited ability to resist it because, as I said, basic things like hand washing and social distancing are not an option for huge swathes of the world's population. So in some places, it will be seen as a luxury to take any precautions. In other places, the precautions are being taken and are seen as very long-term. Every region is behaving very differently, and that's a problem in a globalized world. We don't have any central governance about this. The WHO is faltering as a political entity right now. We're seeing regional and country approaches become very high profile in comparison to any kind of global conversation. We're also seeing people start to refer to after Corona in the news, which is interesting to me because, as I understand it, we're in at least a 2-year struggle against this outbreak. and we're likely to see other similar pandemics come our way in the future. So the solutions that we put in place now are likely to come around again and again, and we need to make sure that they are democratic and that they are justifiable and they're legitimate. We're not very good at negotiating tech in public space. We haven't had to learn how to do this. Technical people are, in general, with some wonderful exceptions, not used to being challenged by social scientists or having to meaningfully interact with social scientists or humanities scholars. But the one thing we know that I was explaining with sort of the diversity of world approaches to this is the tech is going to face a very heterogeneous environment. You know, we need to understand whether other countries are centralizing data or decentralizing data. We need to understand whether other countries are sharing over the long term or are keeping data national or keeping it local. There are lots of things which are going to cause tension and conflict. And we don't have good mechanisms or institutions for debating how to resolve these things in the public sphere right now. And the risk is that they will get resolved in a top-down way that lasts for a very long time. Some of the main problems here are that, you know, public health and government are centralized things by their nature. Government needs information in order to act. Privacy tends to ask for decentralized tech. So we have two camps right now, one of which is saying we need reliable data that is shareable and that is usable over the longer term. We need government to be able to contact individuals if they see that people are not, you know, are either at risk or are causing risk to others. And then we have very reasonable ethicists and privacy specialists who are saying you have to decentralize the information so that no one can identify who is sick and who is not, you know, and stigmatize them and behave badly towards them. So there's conflicting logics here of long-term and short-term, of local and national and international, and of central and decentral, of keeping and using versus shutting down the data after we've used it. It's very complicated, and I think we're going to see a new phase in technology ethics coming out because of this. Thank you.
Thank you very much, and thank you to all of you. So this gives us a chance to open up the discussion, and actually you can turn your cameras on. We'll all be sort of available to each other in that way. A lot of issues to follow up on. I just want to pick up on a point that was raised in the chat area, where a question has come up, and it was partly about the question of the consent of the data subject, as it's been put in a question which was for the panel. Do you think that a top-down approach from government can address the challenges that we're facing in this space? I think we've already touched on that to a certain extent. I had a question maybe to focus it a little bit for Karlin about, to what extent do you think there's competence in the Irish government in evaluating technologies? Inviting you to make a skeptical comment perhaps, but I'd just be interested in your take on it, since as a journalist you probably have more immediate interactions with that cohort, put it that way.
I think it's an interesting time for the government because they're not working entirely in isolation on this, but rather have this whole panel of medical experts who I presume are pretty closely involved in advising on what needs to be done. Excuse me, I think we have a government that doesn't have a really good track record on data gathering or data storage or data usage or large-scale data projects for that matter. They've been taken to the European Court of Justice on some of those issues. We see some of them still being played out on the data retention legislation we have, for example, or that we had, and that the ECJ basically threw out. Not just for Ireland, but for the all of Europe on the thanks to the Digital Rights Ireland challenge. But that our government then, in the years following that decision, never bothered to bring in proper legislation, and so that's led to a prominent court case on its own right, challenging, you know, with many of the predictable things came out of that. The issues that arise out of whether the data that was gathered in that legislative gap was usable in criminal trials, for example. So you have a lot of knock-on effects if you don't get these things right that may not seem very obvious at the time you take decisions or you start a project or you draft laws. I would What concerns me right now is that we know so little about what the government is doing with something that we were told was going to be rolled out in a few days back at the end of March. Clearly, there is some issue there already because the app has not appeared, and we've really heard nothing, not much detail since, outside of what journalists have asked, during question times of government officials. That doesn't, to me, doesn't bode really well, and I would hope that they are taking the time to consider this carefully and to get it right, and not to just go with what they think they would like to do. I would like to see them consulting with some of the data privacy advocates, such as Digital Rights Ireland, who know this area and who probably have a far better sense of what the public might embrace and feel comfortable with.
Thank you.
Trust as pretty much everyone has noted needs to be there. So just I guess maybe I'll leave it there so that other people can.
Thank you. Actually, I want to go back to sorry, did somebody want to come in there? Oh, I think you might be muted there, Rob. Yeah.
Yeah, sorry. I just wanted to come in on the point around openness in relation to the Irish case, because we know practically nothing about what they're planning to do with the app, and yet we're expecting 60, 70, 80% of people in the country to take up using this app. I think if you're expecting the population to come along with you, and in the Irish case, and I know a lot of participants and attendees won't be from the Irish case, but for any country, if you want your population to come along with you, government, and we've been quite good here in terms of a solidarity in a community and people kind of moving along, if you want to retain that, then you have to let people know what you're doing, what you're planning, how it's going to work, what measures you're putting in place, what oversight, what accountability, what will happen with the data. You basically have to reassure people that this is worth doing and that it will serve a useful purpose and it will help them. But if people don't know that and they're locked out and they're suddenly just presented with an app and said, use this, then the take-up will be very low. Linnet's right, the take-up in some of the other countries has been quite low. In Singapore, it's around 15% of people, I think, are using the Trace Together app. It's nowhere near the 60, 70% it would need to be for it to be effective beyond actually manual contract tracing. All it's actually going to do, all this app is really going to do is supplement existing manual contract tracing as it is at the minute. In which case, you have to then say, this isn't just a simple trade of individual rights against public health. There are other implications here, and do we want them or not? It does open up questions as to whether we want to do it or not do it, as opposed to, are we going to live with it?
Yeah, and there is that kind of, seems almost like the default utopianism of technical solutions that we easily fall into. And I think you've referred to the kind of solutionist mentality, which is an interesting way of putting it. Mathieu, I wanted to ask you about your perspective as from a kind of development point of view. And I was thinking partly of, I think it was Karlin's point about expectations that the medical community has, that they place on technologists, and technologists sort of assume the government knows what it's doing. We have this trio who can't necessarily strategize, but make assumptions about one another.
Yeah, no, it is, I believe, a very valid point. Although I have to say, technologists are not so naive that they trust the government to know what they are doing. But no, there is certainly an issue here, which is, I think what you were saying was very valid. That sometimes it's the trio, or every member of the trio does not want to recognize necessarily their limitations and their views. And from the point of view of the technologist, we like to hide behind the fact that we are clear and very precise in our claims, that there is only a certain level of accuracy we can achieve, and it's only what is reflected in the data that is there. And if you want to check what's happening, just look at the code. Obviously, this is a very naive thing to say. This doesn't solve the problem. It only protects us. It's only kind of us covering ourselves with respect to what we are saying as our capabilities, without sufficiently addressing the fact that these cannot be properly interpreted by the other sides. We don't have a translator in between that will say, what the technologists are saying is that what you think this is doing, it's not doing it. And indeed, the aspect of uptake that Rob was mentioning, and a number of different elements is technically, yes, we can figure out whether somebody has been close to somebody else if they have both enabled the app and both enable Bluetooth and the operating system, or the companies controlling the operating system have enabled that, and it's always on, and people don't run out of battery. Yeah, we can. That's what we can guarantee, which means we can basically not guarantee anything, and therefore it needs to be. Say all the different aspects need to be put together, and there has to be a proper reflection on what is the implication of all those technical elements. You know, when Heike was saying we need applications that are robust, and we need to kind of remove bias, and we need to make sure they're accurate. Nothing is ever 100% accurate. Nothing is ever 100% bias-free. So it's in how we are using it and how we integrate that in the interaction and engagement with people that we need to address it.
Yeah, I suppose there's also another risk. I mean, even it's almost separate from the ethical question of whether people then have a false confidence if they think, oh, the app is solving all the problems and we're now sufficiently compliant that we go about our business as usual, which may create, you know, difficulties of a different kind. I want to pick up on well, there's so many interesting questions that have come up here, but one that we didn't so much touch on, I guess, is the question of voluntary opt-in and whether voluntary opt-in really ends up being voluntary or not. I mean, obviously, there's a somewhat extreme case in China with QR codes and so on, which have their own issues of reliability and so on. But do you feel in general that voluntary liability could lead to employers, for example, saying, not so voluntary, you know, this is going to be required of you? Any thoughts on that question? You know, Heike, maybe you had views on that, perhaps, if I could steer it in your direction.
Not entirely sure. I mean, the voluntariness of technological use, even in a totally voluntary system, you're obviously already embedded in certain infrastructures that make things, you know, but where you have potentially less options in terms of, yeah, I want something, but I don't have the option of having anything modular, so I either agree to everything or nothing. I mean, that's been well discussed in relation to terms of use of the large internet platforms, for example. In relation to the data use and the, let's say, maybe coercive structures, I don't know what you had in mind. Is it more that employers say, well, you can only work here if you download this app? Is that the kind of thing you had in mind?
Yeah, I mean, one could certainly imagine a scenario like that emerging quite quickly, where ostensibly it's voluntary, but in fact, systems of control are then enforced in different kinds of ways.
I mean, I think to look at those situations, they're not novel. I mean, there's been a lot said, for example, about, let's say, the use of fitness trackers in relation to insurance rebates and those kinds of things. So it's not a structurally completely new thing. Maybe just more in the sense that it may be much more essential for your livelihood. Mm-hmm. I think what's, from an ethical point of view, what's really essential for those things is to be careful in trying to identify what types of values are at stake here. So, and I think, I don't know who said that at the beginning, that maybe sometimes we're a little bit too quick at reducing things down to public benefit and privacy. There's a lot of other things that we also need to keep an eye on, and really it can be extremely context specific. So in relation to something that's specific to employment, on the top of my head, I can't think of anything very specific, but I would say a careful analysis of what specifically might be at stake in this context would be really important, rather than just looking into the very big narratives of public trust or distrust, of privacy versus public health, that we're really aware that when we use technology in specific contexts, that the nature of these specific contexts and the meaning for our life world of embedding those into them, that there can be a number of things coming up. And yeah, and so I think that's a task for us.
Yeah, thank you. You were kind of muted there just at the end, but I have a question that's come in through one of our attendees that I think is probably particularly for Linnet. It's the question is, how could you elaborate mechanisms perhaps and how the surveillance tech gathering data in countries of the global south might work? Perhaps publishing this data could help democratize the systems. I don't know, Linnet, if you have a view on that or about the special conditions that obtain. You did touch on it in your remarks in extremely interesting fashion about assumptions we're making that are seriously problematic in terms of levels of access to technology and wealth and so forth.
Yeah, so obviously the apps don't spring into being fully formed. They're based on tech, which is already part of market dynamics and often governmental dynamics of control and, you know, and also service. So they come from somewhere. They were already, you know, the people that create them exist within particular legal frameworks and assumptions. And we see apps around the world and the tech that's being applied to this crisis reflecting local norms. Right, so that's obvious. What's interesting though is this debate about consent, which we see everywhere, which I think I'm with Rob on the privacy question. Consent is also a bit of a red herring in terms of large-scale public health interventions, because any other population level intervention, consent is not particularly relevant. We consent by being part of the social contract, right? We're born in a country. That means we give our details to the government so that it can serve us and control us if necessary. What hangs on the if necessary, right? We have structures to provide checks and balances to make sure that what the government does is necessary. For me, this is much closer to that dynamic than it is to commercial tech, where you consent to particular uses of your data. This is something where the ideas we're basing our discussions on are profoundly erroneous. The idea that consent is a useful basis for this kind of tech is really problematic. The idea that, which data protection does around the world, that we equate anonymization with deletion is profoundly problematic. There is nowhere that there is any idea that these two things are not exactly the same. And all the scholarship points to that anonymization is ultimately not possible if you want to keep any value in the data set at all. So there are some fundamental things that are getting bandied around in terms of terminology that I think are profoundly misleading and problematic. I think that we need a climate of complete honesty. People are going to be pushed into using this tech. So it has to be legitimate. It has to be negotiated in the sphere of public reason. It has to be consensual, not on the level of I agree, of clicking I agree, but consensual on the level of I feel solidarity about using this tech with my fellow citizens, and I feel that we can stop it if it does something bad. It's not permanent. Sorry, you should stop me because this is my field of research. Well, there are a lot of things which are important here that are getting neglected in the conversation.
Yeah, and I think Heike had touched on the questions of accountability, which come into the frame, I think, in some of the comments that you were just making. We haven't touched on the things that got a lot of attention about this Apple and Google cooperation, and which is, you know, there have been hurdles that it's encountered, et cetera, in France, and compatibility with the UK operation and so forth. I mean, is your perspective on it that this is a kind of COVID washing, I think somebody was saying. It's an interesting idea. I don't, Karlin, you might have views on this as a follower of these large corporations and their doings.
It's a bit of an unholy marriage. I mean, I never thought you'd see Apple working with Google in this way, but at the same time, I actually think it's a quite interesting proposal, and perhaps one of the more you know, dare I say, positive contributions as because you have two large companies that have have a sweeping control and position of both the smartphone market and the hardware and the device, and then software as well. So if you can get them to work together in a way that's privacy protective and decentralized, then that offers, I think, a way forward of working with apps in which you have less possibility for overt state surveillance because it remains decentralized. Now, you'd really want to understand very carefully about how what proposals might be there and how it all works. And I haven't looked at this in enormous detail, but Apple, I mean, I started from a position of being quite skeptical about Apple and its privacy positions, but I think, you know, what it does with maps is exactly what you want to be doing with information that might identify specifically where an individual is. Instead, they do manage to disguise it through several layers of hiddenness, if you will, and it makes so that you can feel. I think that their data isn't being sucked in and then sold on and used and monetized as it is with Google Maps. So I don't know. I view it as a positive intervention. I know other people might not.
Yeah, I don't know if anybody wanted to come in specifically on that question at this stage. We're coming towards the end of our allotted time. Rob, I just thought I might turn to you just maybe for closing comment. I shouldn't be putting you on the spot, but I'm just kind of interested in your prognostication about how you think this might develop in terms of how the technologies will get embedded. Feel free to decline if you don't want to venture any crystal ball thoughts.
I think it's going to be pretty haphazard, to be honest, and it'll just unfold as it unfolds. And some people will take up the app, some people won't, and then there might be a bit of a social political move to encourage people to do it, and whether people do that or not, I mean, it's quite difficult to know. In the case of the Irish thing, I think an app will definitely appear. I don't think they'll abandon it at this stage, and they've already appeared in lots of other countries. It's then what happens to it. So and also, to what extent does the information become say mandatory? So if I get a message on my phone and it says you've been in near contact with somebody who's tested positive, you now have to stay at home.
Yeah.
So it's now instructing me to do something. Am I going to act on that if I trust the app and the thing enough that I feel I have actually been at risk and I am actually going to follow it?
Yeah.
And is it mandatory? Does that become a legal thing that I have to follow what the app tells me? Yeah. Is it mandatory that if I test positive, I have to tell the app that I have? Or will the government automatically tell the app that I have? And so there'll be a whole series of other questions, I think, that will follow on. And there might be little mini debates around all of those, but they're going to have a government kind of thing. Something that we haven't talked about, which I do think will become an issue, is things around workers' rights. So if companies now start to look at this kind of technology and maybe start to use it, and they start to quarantine or contain or start to put in movement permissions into coming into the company or not, based on based on your testing or on the technology you're using and so on, there might be some kind of interesting developments out of there. So there's probably another area around workers' rights that hasn't really been in any of the debates really.
Yeah.
We've been really focusing on the individual as a kind of a citizen as opposed to as a worker. And it'd be interesting to see what kind of happens with that. Yeah, definitely is the potential for control creep. I mean, it's very interesting that there was a lot of criticism of China for its kind of surveillance apparatus and the way it was rolling out social credit scoring and facial recognition cameras and everything else it's been doing. And now it's kind of held up as, well, they managed to do it by using the tech. They managed to contain the virus, and maybe we should be adopting it. So there's been a kind of a flip round from this kind of negative way that they were using the tech to this kind of positive gloss being put on it. And it'd be kind of interesting to see how that might be play out in kind of Western societies. I think that the points that Linnet made were really excellent about this differential between countries and across different parts of the globe.
extremely interesting. And
you know, how it plays out in that context, I mean, it'd be very, very interesting, particularly around things like international travel and movement and all of this kind of stuff. There's, you know, it's, you know, if the pandemic is still going on in other parts of the world, there's going to be a whole shift in the global economy and the way in which certain businesses operate and so on.
Yeah.
I don't know if Linnet wants to come back in on that, because I thought that we haven't really discussed about that, but I thought it was really excellent set of points.
Yeah, and I was very interested in that in your comment about forms of resistance, or at least pushback in public in Singapore and China being more prominent than elsewhere. I think is really interesting.
We've been seeing pushback in Africa as well. I mean, people tend to lump lower income and authoritarian countries together as behaving in certain ways, but actually, I mean, we have PhDs in our project working on Africa and working on Asia, and we're seeing local pushback in very similar ways that we would in Europe, in the Americas. You know, we're seeing encouraging amounts of courts taking abuse under lockdown very seriously, you know, people being able to make claims and having them taken seriously. So I think we're going to see a lot more unevenness in responses to both the tech and to governmental measures than we would expect to. And I think it's worth paying attention to those because they help us predict what this is going to look like. I think anyone who says, oh, Asians do this, Asians do that, or oh, Africans care about this and care about that is not helping in this context.
Yeah. I just want to thank everybody for participating. It's really been a fascinating discussion. We've covered so much ground, and it's really sharpened, I think, ways of thinking about these questions and issues that we really need to pay more attention to and to be particularly alert to as things develop, not only in Ireland, but in Europe and the world more generally. So thank you, one and all, again. As I say, we have a discussion coming up next week on issues of education, so we're continuing our series. Thank you very much to all of our attendees for joining the session. We'll make the video of this available on the Moore Institute's web channel, by the way, YouTube web channel. So thank you all very much.